When you're beginning your program in cardiac rehab, we use a few different metrics to measure your exercise tolerance. One is your heart rate. We look at your heart rate and rhythm on the monitor. Some programs do that for a short time, maybe 3 to 6 sessions, and other programs do that for a longer period. But we measure your heart rate, blood pressure, oxygen saturation as a baseline, and then we measure it with rest, exercise, and recovery. Another metric we use is called the Borg scale of perceived exertion. Basically, we teach you how to cue in to what your effort or exertion level feels like as you're exercising. And we tie that in with how high is your heart rate, how's your blood pressure, what is your tolerance. Sometimes people who've been exercising will equate their exertion at a much lower level than what their heart rate and blood pressure indicate. So it's getting you to identify what is an appropriate exertion level for exercise. What is moderate intensity for you? What is too high? So in the beginning, depending on the event that you had or the intervention, if you are on a beta blocker, which is a medication that lowers blood pressure and heart rate so that your heart doesn't work as hard, we will often start out with a target heart rate of your resting heart rate plus 30 beats. So if you come in with a heart rate of 70, we use the 70 to 100 as your exercise range. Now for some people, they are very sensitive to beta blockers and their heart rate doesn't budge much past that, even with higher intensity of exercise. For others, that becomes very limiting, and at that point, we will contact their cardiologist and ask for a higher exercise target heart rate, or what is the maximum exercise heart rate for that patient. Now, if you've ever done a stress treadmill where you're actually on the treadmill and they are driving you in a short period of time to identify your maximum heart rate or 100% of your heart rate, well, we don't do that in cardiac rehab. We don't push for max. We tend to try to exercise between 60 to 85% of one's max heart rate. And we'll use a guide to kind of have a range, but that is something that can be identified from your cardiologist. If you're not going through a cardiac rehab program, you can ask them, what is my maximum heart rate that I can exercise to? And it's not that you want to push to that, but you want to gradually build up to intensity, first building endurance and then gradually increasing your workload so that you're maximizing your cardiorespiratory fitness level. A metric that we use is called a MET level, the energy that our body is consuming, the oxygen consumption over our body weight. It's kind of a big calculation. But it gives this metric called MET level. After one has built up their endurance to 40 minutes of aerobic exercise, we will gradually increase their workloads to maximize their MET level. Why? Because studies have shown that for every MET level that you increase in your cardiac fitness, your risks for heart disease go down by 12 to 13%. So you can see there's a lot that goes into exercising in a cardiac rehab program, as well as the education that happens that helps you learn how to change lifestyle practices that are going to reduce your risk. What are your risk factors for heart disease, and how can you modify your lifestyle so that you can decrease those and reduce your risk of any future events? If you have any questions about exercise or cardiac rehab after a heart attack or an intervention, please put them in the comments. I'd be happy to answer them.